worried about you, Atlanta. We went into an emergency medicine to make a difference in people during critical periods in their life. There's a golden window where we need to take care of you.
The concern about stroke is time is brain, and delays lead to increasing damage to the brain, and increased damage to the brain results in increased disability from the stroke. You should think fast. F is face. Have person smile, and when they smile is one side of their face drooping. A is arm. Have the person raise both arms up in the air and determine if one of their arms seems to be drifting down. S is speech. Have them repeat a sentence. If their speech is slurred or if they're having trouble getting any of their words out, then that could be a sign of stroke. And T is time. Time to think fast and call 911.
We've designed all of our emergency department flow with COVID-19 in mind. From the very first time that you present to the emergency department, you're screened for symptoms that might be suggestive of having COVID-19. And if you screen positive, we will move you to an isolation side and take you directly back into a private room. If you don't have COVID-19 symptoms, which is the majority of the patients that are coming to see us, you are really never going to interact with somebody who's clearly at risk for transmitting the disease to you.
We have outstanding treatments when patients show up early on after their stroke to reverse and prevent damage to the brain caused by a stroke, and patients who would otherwise be disabled with treatment can actually walk out the hospital door having minimal or no deficits.
If you're having symptoms that are concerning, please don't wait it out.